Irfan come?
He
Yes,
has some
wait.
problem in the connection actually. Since yesterday, his connection is not okay because his voice is coming late to us.
Ada's meeting yesterday, she told that first of all, when we say good morning, good afternoon, then we will have to wait. We are not supposed to continue good morning, my name is this. Let's wait. Let the role player answer first. And same was there here. He started his communication by saying good morning, I am Dr. Irfan. He didn't wait for me. And then he used the word Miss, not Mrs. Yeah, whereas it is mentioned Mrs. Watson. He said Miss Watson. First of all, this thing was there.
Mm-hmm. And
When I asked, then I asked him that since you have told that if the treatment is started earlier, then there will be less chances of cure is much better as compared to the if the treatment is started later on. And I asked him again, so my child has been started admitted here on the second day of the fever, and he has been started medication very early, so will he be free from these side effects? He said yes, yes. He started his sentence with the word yes, and earlier the better. He should have explained it to little bit that that is that if we start the treatment earlier, the chances of the complications are much better. But we will follow your child. Later on, when I asked him second time about so will my child be okay, you are saying yes, and the earlier the better. Then he explained that we will follow your child with the heart jelly scan, and he used the word echo. I don't know, we can use the word echo or we should use the jelly scan of the heart. And then he explained about this. Then when I asked about this aspirin, he said it is the part of the treatment and we have to weigh the risk and the benefits. Whereas I think he should have added one sentence that although we give aspirin, but we can keep an eye on the major side effects like abdominal pain, and we try to give some protective some medicines which keep the child safe from the abdominal discomfort.
Most worrisome for the
Dr.
aspirin
Fatma,
is
Yes, Dr. Irfan, should I start from the first point which I have
Dr.
given
Irfan
earlier?
can. Okay.
yeah,
Yes.
actually, I
Yes.
got your point. What we can give for the prevention of your concern? Actually, aspirin we are giving
Yes,
to the patient with the Kawasaki disease, and we haven't got
that's
any
right.
problem. And I have treated many Kawasaki diseases, and we're given aspirin with high dose initially, and there has been no side effect, as you told me.
Yes,
And we're not giving
yes, you're
anything
right.
other than aspirin. There's nothing. We need to balance the side effect and the what is called the benefits. I don't know, but maybe you are right. I appreciate your information. But what allow?
Yes. Yes.
That you
Yeah,
need
yeah,
to explain to
yeah.
mother in a simple language.
Sorry.
The same thing which you
Yeah, maybe
are saying.
Yeah, you are right. Right. Yeah, no, just telling you. Hmm.
Yeah.
So
So
wait
uh,
for let the Dr. Fatma to complete her feedback. Then Dr. Irfan will say that what is
Okay.
okay.
Okay. Okay. No
Because
problem.
Dr.
Dr.
Fatma
Fatma,
started when
carry on.
you were not there, so she had
Yeah.
also taken two other points initially. So she will repeat again.
Okay.
Yes, I started
Uh,
my feedback with the point that that since my child has been brought on the second day and he was started
uh-huh.
treatment rightly after the diagnosis, so he will be free
Yeah.
of
Yeah.
complication. You said yes. I want to say that impression came to me that my as my question was all right, and I have asked that treatment was started in time, so my child will be free of complication. I just wanted to say that sometime starting with the sentence with yes, it gives the impression that yes, since treatment has been started in time, so child will be free of the complication and side effects.
Yes, you are right. I didn't cover up my sentences. You are right. I should say, with this, with the help of jelly scan of the heart, we can see all this problem if he is safe from the complication or
Okay.
not. You are right. Okay. Yes, right.
Okay,
Okay.
and
Yeah.
you gave the justification that aspirin doesn't cause the stomach ulcers and so many things. You're right, but I think we have to give surety to the mother or to the attendant that we will keep an eye if any complication at any time it happens, we can treat that accordingly. Otherwise, you gave me the explanation that weighing the risk and the benefit is
You are right.
important,
Okay.
and
Yeah, yeah.
as
Because I was, yes, right. Okay, no problem.
that was my point.
That's great. Okay.
Otherwise,
Good
explanation
feedback.
was
I
right.
appreciate.
Explanation was right, and
Yes.
despite of the connection problem, you
No, no, right, right.
find
Really, I appreciate your what are
uh,
you giving? Really, I'm happy. Yeah, yeah,
Okay, so
yeah. Many
anyone
times because
else?
yeah,
Anyone else has a feedback?
I want to add a few things.
most welcome,
Mm,
most welcome.
No, no, this is not
First,
feedback.
give me negative point.
No, no, this is not feedback actually.
Add
For
back.
the aspirin in the leaflets, they have not written about the gastritis. They have written about the Ray's syndrome.
Ray syndrome.
Yeah, Ray's syndrome. I have studied from this leaflets of
Because Rohel, we have
Gauche.
treated many patients uh, no, no, in the when I was somewhere else, and we have been lot of cases every month. We have 2 to 3 patients with the Kawasaki disease, and we
Yes,
have been giving high dose aspirin, and we never give any antacid.
yes, I am telling you in the leaflets of Gauche, the most popular leaflets of UK, they have written that the uh, to consider about Ray syndrome also, but we can tell outweigh the benefits against the risk. This thing and the other thing, this is feedback for you. You have I don't think so. You deliberately said in the flow of the like this sentence, maybe you said you will do the echo before the treatment and after the treatment. Actually, they are not doing the before the treatment. In the guidelines, they are starting the treatment and they will do the echo on the 10 and 14 days. Then they will do on the 6 weeks or 6 months.
6 weeks, 6 weeks. Maybe,
6 weeks.
yes, I slipped. Yeah, you're right.
Yeah,
Yes.
yeah. You have said that
Actually,
you
you know
will
what
do.
happened today? I'm sorry. I was preparing the scenario which is done by Dr. Rashida. I
Mother will not
No,
ask
no.
you that when
You
you
will
do.
have to
It's your
tell
job
that
when
we will do the
you
jelly
will
skin.
do and why you are not doing now. So this you should be able to tell the mother. Okay.
Yes,
In this case,
this is
in
the
this
thing.
scenario. Yeah. So about the aspirin, like every drug is causing nausea, vomiting. So high dose aspirin may cause some issue. Maybe even though, as Dr. Irfan says, they are not giving antacids. So, but every drug has the first side effect is nausea, vomiting, and some gastric problem. So in children, if we treat with a high dose of aspirin, as you said, the Rett syndrome, so we can tell the mother that like every drug has some side effects. This also has side effects. We have the good team of doctors. They will monitor closely and they will see if there is any side effect. They will manage accordingly. So by this way, we should tell for the every drug. It's not, and even though we don't know the particular side effect, but we should reassure the mother. We are not supposed to tell that Rett syndrome it will cause Rett syndrome or anything. But if
Yes,
they are knows already, they will know that this causes Rett syndrome. I read from internet. Then we should have to explore about it. Otherwise, no, this is my opinion.
Dr. Wakan, it is written, it is thought that the side effects from the aspirin are much more rare than the heart complication which may occur with Kawasaki disease.
Yes, true. So the basic idea of giving to prevent the heart, as you mentioned, the risk and benefit in their scenario.
Prevent the clot formation.
Okay, anyone else has a question? Actually, there is one incomplete, just for your knowledge, incomplete Kawasaki. In incomplete Kawasaki, they are not all the criteria they will meet. So if they have the peeling of the skin of the hands and fingers, then they will do the echo. If there is no peeling, then they will not do the echo. They will just treat as an incomplete Kawasaki. They don't have all the symptoms
Mhm.
because there is no particular diagnostic test. So only with the symptoms and inflammatory markers, right? Clinical features and this.
Okay.
So shall we go for the clinical cases? We have two clinical cases.
Okay.
Dr. Rohil, are you ready for it?
Yes, I will try.
Still you will try. So Dr. Irfan, don't do mistake in the names, as Dr. Adil is also focusing in this.
I'm sorry for what? Come again,
Names in the
Dr.
names.
Wakan?
Names of the patient and names of the mother, Abdullah
Yeah.
or mother.
Yeah, really. Thank you
Because
for
Dr.
that.
Irfan is focusing,
Inshallah.
Dr.
Inshallah.
Adil is focusing on these things too much. So it means it's important for them.
No,
I
we
have a
have to follow. Yeah, actually, no, inshallah. From question, please.
yes. So in my case, as Dr. Ruhail, he said like yes, I'm Morrison. He did not said like I'm Mrs. Morrison, and then I kept on saying like so Mrs. Morrison, Mrs. Morrison. So in the start, I can say like so can I call you Morrison if you are happy, or should I just continue with Morrison as she was saying?
Whatever in the stem they have written, you can continue that one.
Okay,
Are
so
you
I should not say
particularly,
like
or
hmm,
particularly you can ask in the beginning, should I call Morrison or Mrs. Morrison?
okay. Only in this condition, like when this like mother itself herself said that yes, I'm Morrison. Then I was confused,
Yes,
like how
yes,
to call him. Okay,
yes. No, that was my mistake actually. I told you I'm not in
it
senses today.
can be no,
I'm
no,
not feeling.
it can't be a mistake. Now it can be, it can happen in real life. Now in the real
Yeah,
case
yeah.
scenario, it can happen. We should be prepared for it. Okay,
Actually, I'm not feeling good today. Why? I don't know.
You?
Okay, boss.
Are you not feeling well today?
Yes, I'm getting fever. I don't know why.
I hope it is seasonal.
Huh?
I
Your
hope it
voice
would be
is coming.
Seasonal fever?
seasonal. I
Yeah,
hope it would
seasonal.
be
Inshallah.
seasonal.
Inshallah.
Inshallah, nothing will happen.
Don't scare me.
No, we are at high risk. It's true.
Yeah, don't scare. Yeah, Dr. Wakan, please.
No,
Yes.
I'm not scaring.
We are very
Yeah,
sensitive,
really?
for
I
sure.
have
Thank
worked.
you.
I have worked with the corona patients almost 5 months. Alhamdulillah, I was fine.
And you got the herd immunity.
I was
Yes.
not scared. I was not scared at that time.
No,
But
scared from
now today,
no, scared from the Allah. Allah protect you.
yes, this is the thing.
I yeah,
We
I
should take
does
But
like
today I'm
we
that.
not.
should take your precautions as well.
Yes.
Dr. Wakan,
Yes.
I'm sorry. Yeah, last time I was emotionally upset. I'm sorry for that. Really, I should control
Don't
my
be,
emotion.
Dr. Irfan, don't
No,
be,
no, no,
please.
no, no, no. Communication. This is also communication skill. We should address nicely in a very positive way. This is lacking.
It's
I'm
okay. It's
telling
okay.
my.
looking for the paler, and then I will go for the check the pulse. Pulse is normal, and then I will look for
No
the
commentary. No commentary. Do it, please.
I will look for the scar mark of
Talk
BCG
to
scar
the
mark.
child. Talk to the child, please.
Okay, I will look for the BCG scar mark. I'm looking,
Mm.
and please, Simon, can you see down? I'm looking for and see up.
Mm.
I'm looking into the
Yes.
eyes. Please, can you
Yes.
open your mouth? I'm
Ah.
looking. Okay. So, is there any no sinus? Okay. Then I will move to the any scar mark in the neck, or
No scar.
and then okay.
It's
Then
in
I'm
front
going
of
to the
you.
okay. Uh, he's already exposed, so I'm looking for
Yes.
the okay. I'm going giving the inspection of the chest. Is there any score for lateral thoracotomy score, any drain score, any biopsy score, any devices like portacath, anything? Then there is IV line on the left side. Okay, that then I will okay, Simon, I will uh, touch your chest with my gentle hands. Okay, I'm doing the palpation on the three. uh, is there any asymmetry in the movements?
No.
And okay, then I will do the tactile vocal frametrance. Please do say 99.
99.
Okay, is there anywhere increase of tactile vocal parameters?
No.
Okay, mm, I will check the trachea also. Trachea is in the central position.
Yes.
Okay, uh, Simon, now I will tap with you my finger. I'm doing from the apex, then in the upper lobe, middle lobe, and the inferior lobe on the both sides of percussion. What about the um, percussion? Is it resonant, hyper resonant?
No, it's resonant. Bilateral.
Okay, okay. Now I will I I will listen your chest now.
Okay, doctor.
Okay. Uh, I am doing in the from four areas in the upper clavicle in the apex, then into the
There
upper
are
lobe,
wheezes,
middle lobe,
bilateral.
bilateral wheezes is there. What about
Hmm.
this normal vesicular breathing?
Yes,
What
the
about
breathing is
inspiration,
okay, but
expiration?
they are
What about
wheezing which are
inspiration,
more on
expiration?
expiratory wheeze.
Okay. Then I will
Prolonged
move to
expiratory component.
prolonged expiratory wheeze. Okay. Expiration. Okay. Then I will move to the back. I will do the same palpation. And is there any hyperexpansion?
No,
Then I will do the uh, uh, percussion as three
normal
areas.
bilateral.
Okay. And the auscultation in the
They
three
are the same
areas.
wheeze.
Same.
Hmm.
Okay.
Auscultation on three areas.
Three bilateral.
Okay. Hmm.
The same findings
Same
like
finding
in the
is
front.
on front.
Okay.
Yes.
Then I will ask
But
Simon, please
okay, doctor,
add
please
on.
say thank you to the patient and your time is finished. Just explain me your case,
Okay.
please.
Oh my God.
Okay. Today, thank you for examining Simon. Today I have examined Simon, 9 years old, who is looking small for his age, but I would like to plot him on growth chart. And in the surroundings, there are nebulizer, inhaler, and the face mask is there. and there is IV line on the left arm, and there is no cyanosis and clubbing, and on the inspection of the chest there is no deformity or Harrison's. There is Harrison sulci, and on the percussion there is normal resonant, and on auscultation there is a wheeze bilaterally, and expiration is prolonged, and putting all together these findings, my expression is Simon is having a condition, asthma.
Very nice.
So, doctor, what other thing you can suspect in Simon?
What other things, as there is no clubbing and no cyanosis are there, so very less likely other conditions like one more thing should I kept in mind that cystic fibrosis, but in cystic fibrosis there will be some I can find some scars are there, IV cannulation scars or some clubbings can be there,
How would you confirm the
but
asthma in this patient?
how will you how will you
How will you confirm that he is having asthma?
yes, we will do spirometry, and I would like to complete my examination to do ENT examination and the lymph node examination and peak flow meter to check this spirometry. And if it is less than 80, then this is shows that this is obstructive lung disease, most probably due to the asthma.
You not check SpO2 in this case, saturation, heart rate.
Yeah, saturation, we if it's coming in the emergency, then we will have to see this is the mild, moderate or severe. In the mild we will have to check the heart rate, we'll have to check the respiratory rate, we will have to check the oxygen
Only in the
saturation.
emergency.
Most of the time in the emergency we are doing, in the OPDs we will have to take the history
In this
and
patient, you will not do because he has a V's bilateral and said Harrison Sarkai. You will not do in this
yeah, we
case.
will have to check, we will have to
This
check the
patient is
oxygen
not in
saturation,
emergency.
we will have to check the saturation as well.
Okay. Thank you. Time is up.
Yes, boss. Sorry,
Okay.
actually,
Yes. Yes.
I know
Not
so
actually.
many
You're sick.
mistakes.
You have fever. I will not say you anything.
No, no, I'm listening.
Yeah, no, it is okay. You went through all over the steps almost, but there's something you missed because you were time consuming. Because I told you do not do the background commentary, just do it and be communicative with the patient. But even though you were telling about everything, so
Actually,
that's why the
this
time
is,
is too much.
yeah, I know, but I
Mm,
don't know.
mm.
This is that day Dr. Voila said you will give the commentary, what you
No,
want to see.
y-
And Dr. Adil is
yes,
saying don't give
Different
the
we
commentary, I don't know.
different people have different opinion.
Even Dr.
yeah, we
This one
discussed
is
last
Yeah.
time that
in Saudi.
we it experienced ourselves first without commentary, then maybe for other thing we will do also with the commentary so that we will be experienced in the both cases. If examiner wants us to do the background commentary, or they are more happy in virtual exam, so that we should be able to do. But nowadays we are doing without background commentary. As Dr. Adil said, we
Okay.
should be able to do both because background commentary it will having a time consuming, so it's not
I left only the abdomen.
okay. Only abdomen.
I reached.
Okay.
Dr.
I
Rohit,
reached
did you
the
check
back.
the dextrocardia?
Yes, I am telling you, I forget that one. And I remember. No, no, I did
Uh,
not remember. I remembered when I was doing percussion. So I want to say, I don't know. I don't know actually that time time we should check or should add at the end? So I want to ask Dr.
Well,
Bakar actually.
no, actually, you can do it, and when you recall something, and you if you
Even at the end,
Yeah,
yes, you're
that's
right.
I don't know. When I start this percussion, then all of a sudden, oh, I forget Apex.
Okay. So, Dr. Rohil, like,
Dr.
as you
Rohil, did you
said, you
comment
missed
on
the
this patient,
points.
his physique?
Yes, I comment. Dr. Bakar, give your feedback. Then we will go to the Dr. Bhatti.
Okay. So, as you said that you missed the
Okay.
points in the respiratory examination. So, after the pulse and you reach to the eyes and mouth oral examination, what points you supposed to check in the respiratory examination from neck and the chest point of view?
What, Dr. Bakar, दोबारा कहना था? Come again.
या मैं कह रहा था कि कौन सी पॉइंट नेक और चेस्ट में डॉक्टर रोहिल जो है वो चेक करना चाहेंगे इस पेशेंट
On
का
Neck
inspection, you mean?
वन बाय वन बताएं
neck में
या
inspection
मिस
for the scars
inspection
of any.
palpation auscultation all tell me one by
Dr.
one you will
Bakar,
check what yes
Dr. Bakar, you want to ask me from the starting from the neck, huh? What I want to see
neck and chest both after oral
in
examination
the neck, you should check the lymph nodes. Is there any
okay
scar of lymph node biopsy or
okay
any IV line scars? These are the three things.
भाईजान,
okay
भाईजान ट्रेकिया किधर
what
जाएगा?
ट्रैकिया तो मैंने चेक किया है. I did check.
I'm sorry for that.
No, I did check.
okay what else in the chest
Chest, you will have to do the first of all do the inspection. You will do the deformities, pectus,
no I'm
carinatum,
not
excavator.
asking what you will do what you will look for I'm just telling you the steps
In the chest, you will do first inspection.
okay
Okay. Then you will do the palpation, and in the palpation, you will do the apex also, which I forget.
okay
And
okay
in the palpation, you will do the at least three. You will check the chest expansion at 3 levels, and
yes
you will.
you did it
Yeah, I
No.
told you. No, I told you.
chest expansion
I told you I'm doing chest infection on 3 levels. I told you.
okay
I
I
did
couldn't
not.
hear okay
This one I did not forget. I forget only apex.
okay chest expansion but after that
After that, after doing this, the chest expansions, then you will check the tracheal, uh, what we call tracheal tug.
okay then
It is central or
okay
not. Then you will do the percussions.
then
Percussion is on the 4 areas. In the above the clavicle.
yeah now I'm not yes okay after percussion
After percussion, you will go to the auscultation.
after that
After completing the
Vocal,
auscultation, you will tactile vocal fremitus I did, but this what else? This vocal fremitus, not vocal. This is what other on the auscultation, which I forget.
what
This is what on the stethoscope we are doing.
repetitions
Vocal resonance.
Huh?
But you don't need it's vocal.
Vocal resonance.
Okay, you don't need
yeah
it. The TVF.
books it is written either you do one other you do
Yeah,
vocal
that's why
resonance
I
or
did not
vocal
do most of
in the exam
people.
yeah
one. They are not
Most of
doing
the people
tactile
are saying
parameter.
either do the tactile or either do the vocal resonance.
yes yeah one of whatever you feel easy
Yeah, I